Hello, I'm Dr. Robert Lelouch, board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about breast cancer risk assessment. Now, this isn't going to be a tool for you to assess your own risk, but it's to explain some of the meaning behind how you can get a risk assessment for yourself and to encourage you to pay attention to that. So overall, the lifetime risk of breast cancer for women is about 1 in 8, which is quite a high number. Of course, everybody has 100% risk of getting something eventually, so that's lifetime risk. But with it high enough, 1 in 8, about 12%, we encourage you to get your screening, to speak with your physician. Mammograms starting at 40, depending on your risk level, might even be earlier than that. But I'm focused today on telling you about the Tyrer-Cuzick risk assessment score. And that is something that you might be provided in your mammogram, but you might not be looking at it. And I want to specifically address whether your risk is high enough and whether you might need MRIs in addition to mammograms, okay? So there'll be some references below for risk assessment, but if you are of the age 40 and above where you're getting mammograms, I encourage you to look at your mammogram result and you'll see different categories, and you can see my other video on mammograms. But in addition to that, category 1, category 2, on up all the way to 6. But category 1 is the best score you can get. Category 2 is looks good, but keep need some follow-up, or areas they're going to follow. If you have that low risk, you may still, even though the mammogram looked good, you may be at higher risk, and you might have that reported on your mammogram report. It's called the Tyrer-Cuzick score. If that score is above 20%, that puts you in the high risk category. And latest recommendations are that every 6 months after your mammogram, you should get an MRI. The MRI gives you a little bit more specificity. It's more expensive, but it also doesn't replace the mammogram. They each have their pluses and minuses. So the most important thing I'm trying to get at here is, if you don't have a knowledge about your own risk, that's something you should be discussing with your physician. And this is a relatively, in the last few years, trend to add the MRIs, and we're doing them more increasingly, and it's based upon that Tyrer-Cuzick risk score. And that score is based on questionnaires and looking over time at women who end up with breast cancer and those who don't, and filtering out what data supports these risks. And then talks about how many kids you've had, whether you've had breast biopsies, your family history of breast cancer, when you had your period, and also factors in the breast density, which is why you should be getting it from your mammographers for when you get your mammogram, or at least to be factoring in the breast density that you get on your mammogram to your scoring process. There is an online score, and I'll have that link in the video, so you can do your own online risk assessment. But I encourage you to find out if it's already being done for you, if you've answered some of those questions, and see what that score is, and make sure you're below the 20th percentile, or discuss it with your physician, because I think that a lot of women are at higher risk and are missing out on the opportunity to get the additional screening of an MRI to better ensure your future health. So I hope you found this information of use. Please look at the links to help assess your own risk, but this is something you certainly should be talking with your provider about. Thank you.